So in terms of practical steps to manage depression in Parkinson's, the first thing is obviously to ensure safety. And then, once we've addressed the issue of safety, then we need to exclude or treat possible physical causes of depression. So that includes a really good physical examination. It's important to have comprehensive blood tests, including looking for abnormalities of thyroid function, which interestingly are actually more common in people with Parkinson's disease. So that means having those blood tests, a really proper workup with your GP. And then looking very carefully at the medications, and this is where liaising with your neurologist is very important to think very carefully about the potential for non-motor fluctuations and a wearing off effect, such as, for example, anxiety being worse in the off state or mood being worse in the off state, because sometimes there's interventions that with the dopaminergic medication that can help to address that. Avoiding alcohol and other factors that might be contributing to depression is also very important. So once we think about those biological factors, then we need to think about strategies that will have enduring benefits to manage depression and to manage anxiety. And psychological therapy can help to manage depression. There's evidence now to show that cognitive behavioural therapy is helpful. And I'll talk a bit more about what CBT is, but it's very useful to think about adding some of these tools to the kit bag, because they can be helpful for managing depression in the longer term. So some of these interventions like cognitive behavioural therapy will have enduring benefits, whereas a medication will only have benefit for depression whilst that person's taking the medication. And combining CBT with an antidepressant may be a more effective strategy than medication alone.